Care2 folks, this is Heather. I'm here in Big Tent, Denver, and I'm really honored today to be with Roger Hickey, who's the co-director of Campaign for America's Future, and Richard Kirsch, who is with HCAN, which stands for Healthcare for America Now. Did I get that right?
Yeah, right.
Now, HCAN is a brand new organization. It's a coalition, really, of nonprofits who are working to bring universal health care to America. I'd like to start with you, Roger, because I've worked with Campaign for America's Future for many years in various capacities, and this is something you guys have been talking about for a long time. So tell me what you're thinking at this point about this moment in terms of where we are, how Americans are feeling about their health care, and why you think there's sort of a new opportunity here.
Well, it's clear if you talk to Americans, if you poll them in public opinion research, people are really worried about their health care. People who don't have health care, of course, want good coverage, but more and more people who thought they had decent health insurance are worried about costs. They're worried about losing their health care. They really need something to be done, is what people say. Somebody ought to do something about the health care mess. And for many people, it's starting to feel like a crisis. So Richard and I and lots of people on the progressive side of the debate have been working for a couple of years now to try to figure out a message, a plan for healthcare that could address people's worries about lack of insurance and cover everybody, but also reassure people who have coverage that we can help them keep their coverage, and we can help get them better coverage if they need it. So we did a lot of good work with the candidates early on. John Edwards came forth first.
Sure.
Then we helped him develop his plan, and then we went to the other candidates, and they had to match him. So we're feeling very good about not only the ideas and the principles that we've got the candidates beginning to talk about, but also, more importantly, about the coalition that Richard has played a crucial role in putting together, that is united around a vision for healthcare that can really get passed in the next Congress.
Sure. Richard, could you tell us a little bit more about the coalition? I'm very interested in how the politics of this issue has sort of evolved, right? Since we had the 1993 debacle, everybody remembers the Harry and Louise and all the stuff around that. But it seems like the politics have shifted, not just within the progressive realm, but also maybe within the business community a little bit, as their anxieties have risen around these healthcare costs that seem to be spiraling out of control, and they have to make very difficult choices on behalf of their employees.
Well, back in 93, 94, the health insurance industry said, don't have a government solution, get out of the way and we'll fix it. And they introduced something new they called managed care. And they said, we'll have managed care. And what they did, it's interesting, they actually lowered health care premiums to take the political pressure off of change. And the business community either stood on the sidelines for the most part. A few businesses were supportive of change, but most of them stood on the sidelines, and some of them opposed reform. Well, here we are 14 years later. Health insurance costs continue to skyrocket. Once the pressure for any kind of government action was off, health insurance companies raised premiums to the roof. Managed care turned out to be a total failure in terms of controlling costs, and a disaster in terms of access to quality care for a lot of people. And so businesses have realized they don't want to be fooled again. And the reason that we actually do need a government role in solving this. Now, that doesn't mean government taking over the healthcare system, but it means allowing businesses, if they want to continue to provide health coverage, but it also means that businesses understand that we need to be sure that there's some regulation of the health insurance industry, that we make health coverage affordable for everybody, so everybody's in the system.
Sure.
Businesses understand they're paying for people who aren't covered right now. And so one of the most encouraging things really we're seeing is that the business community has changed. The other thing we're doing in Healthcare for America Now is we're organizing small businesses. The small business lobbies, group like the National Federation of Independent Businesses and the realtors and the restaurateurs, they're ideologically opposed to any kind of requirement that employers have to pay for coverage, even if that requirement would save employers a lot of money. And really, if you have the right kind of system, we can make healthcare more affordable for small businesses. Right now it is out of the price range of a lot of them. And so we're organizing small businesses who understand that they're for quality, for healthcare for all, and that the small business trade associations actually don't represent them.
Tell me a little bit more about the coalition and the work that you're doing, really, as you're just getting underway here as an organization. So looking at the fall and then looking ahead to 2009, because ultimately that's sort of what everybody's looking ahead to at this point?
Well, what we're doing in 2008, the goal is to set up for 2009. So basically what we're doing is we're working to basically ask the country a question before the election, which is, which side are you on? The side of quality, affordable health care for all, or the side of being left on your own with the private insurance industry? And there's a big contrast. If you look at the plans of the two presidential candidates, you'll see the contrast. McCain's plan basically encourages more purchase of private health insurance. Doesn't regulate private health insurance, he weakens regulation. He encourages high deductible plans as much as $11,000 deductibles. He gives you a tax credit that'll pay for only a few months of your health insurance each year. And so that's one approach. And instead, there's the approach of quality, affordable health care for all, guaranteeing coverage, benefits to meet your needs, affordable to your family, affordable to employers, through regulation of the private insurance industry, and also giving you a choice of keeping your own plan or a public plan so you don't have to be at the mercy of private insurance. So that's the choice. And so what we're doing this year is we're saying the election's about that choice. And we're asking members of Congress and candidates for Congress and the public as a whole, but focusing on people in Congress and running for Congress, to say, which side are you on? The side of quality, affordable health care, or the side of you're on your own with the insurance industry? And the idea is to, when January of 2009 rolls around, to have a president and a Congress who are committed to quality, affordable health care for all, so that we're starting, they understand what the public wants, and when they get to Washington next year with the drug company money and the insurance company money and folks opposing reform, they'll remember that they promised their constituents that they'd actually stand up for real change.
Right. So one of the questions I always ask people when we have an opportunity to talk to them is, what can Care2 members do? And I know that we are working with HCAN. For those of you on Care2 who have visited our petition site in the past, there is a petition you can sign on Care2 right now, talking about exactly what Richard, supporting exactly what Richard was talking about in terms of which side are you on and standing up on the side of universal health care. Richard, I'm curious, are there other things that Care2 members were very grassroots focused and active and really interested in making a difference? Are there other things Care2 members can be doing?
Right, well, we've got a great tool which is fantastic online. It's called Click to Call. And so what you do is you click on it, and it will give you a little script. You can put in your own words, but suggestions of what to say to your member of Congress. Then your phone will ring in your house. It'll actually connect you to your member of Congress so you can deliver the message, you want quality, affordable health care for all. You hang up, it'll connect you to each of your U.S. senators. So that's a way you can actually directly make a call to your member of Congress and to your senators saying you want quality, affordable health care. And so I'd encourage Care2 members to go to the Health Care for America Now website, click to call, and then also send that link to all your friends. You know, go through your address book, send it to your friends, because we need to generate thousands of calls to members of Congress saying they're for quality, affordable health care. One of the things, if you like to have a barbecue or invite some friends over.
I like barbecue. I like it. Yeah, sure.
So on September 14th, and Sunday, we're going to have Health Care for America Now house parties and barbecues. It's a Sunday all across the country. There's a new short video we'll be showing that the folks at Brave New Films, the ones who did Outfox, did Robert Greenwald, did a special video for us. So have a few friends over, talk about health care. If you want to make a donation, the donation we suggested is, if you want to make a small donation, you're at your co-payment for preventive care, a bigger donation, your co-payment for specialty care. You want to make a really big donation, your deductible. And
I don't even know how big my deductible is, so I can't commit right now. Yeah, I don't know.
But basically, the guys that we're going to write to members of Congress. So it's a way to have some fun, organize people, and get people involved in this movement.
Great. Richard Kirsch from Health Care for America Now. It looks like we lost Roger over here, but thanks for your time and have fun with the rest of the convention.
Thanks, Heather. Appreciate it.